All right, this is preparation for test number 2, including GI, heart, and diabetes, plus hyperlipidemia subjects. Let's move on. GERD, symptoms of heartburn, high salivation, and regurgitation for more than twice a week. Initially, we will do PPI daily for 8 weeks, and maintenance will be PPI at lowest effective dose. So if we're looking at the GERD, the most important, we will start with lifestyle changes. The medications that are treating not only PPI but also antacids and H2 antagonists. PPIs are proton pump inhibitors. They end in prazole. So omeprazole, esomeprazole, that's the OTC and can be prescription drugs. And another one is lansoprazole. And the prescription drugs are pantoprazole, everyone knows by Protonix, and dexlansoprazole. Combo can be also used, and it is OTC. That's omeprazole, which commonly used as a Prilosec plus sodium bicarb. It is very important and of the time administration. So you give prior to meals about 30 minutes to 1 hour before the meals. And length is usually 4 to 16 weeks, depending on the drugs, depending on the dose and also indication. So for the effects, you need to take for several days, and then if you do that, you need to taper off when discontinuing. The thing to remember is one of the side effects is very high risk for C. diff. So remember, with PPI, you might have a C. diff. You also have headache, nausea, and diarrhea possible. It is irreversibly inhibit enzyme hydrogen and potassium ATPase, and also decrease secretion, acid secretions. That's the MOA of these PPIs. We need to be cautious. Again, a reminder, C. diff is a very high risk. Other cautions and adverse effects would be osteoporosis, bone fractures, decrease in B12, calcium, iron, magnesium. All of them will be decreased, and increase in CAP. Drug interactions, a lot of drug interactions, and cardiovascular events in patients who are on Plavix when you use it together with PPIs. Usually the PPIs used for GERD and as well as H. pylori and PUD. Okay. Antacids that will be another treatment for GERD as well as H2 antagonist. So antacids that will be including calcium carbonate, known as TAMS, magnesium carbonate or magnesium hydroxide, so milk of magnesia, and also aluminum hydroxide. You can see that all of them are cations, so it's like with a plus at the end. The mechanism of action of antacids is, of course, decrease acidity. It will increase gastric pH through neutralization. So side effects of antacids would be constipation, electrolytes imbalances, some diarrhea, and we have to be cautious with renal disease and as well as interactions. So we know that some of antibiotics, for example, tetracyclines and fluoroquinolones, they are not be taking with antacids, so you need to be very careful about that. H2 antagonists would include famotidine, and usually they all finish with tidine. It's like tudine. So famotidine, that's pepsid, and I think it's ranitidine, that's a Zantac. There's another one that is cimetidine. I think it's a tego something, but that medicine is what kind of should be avoided. It has a lot of side effects and a lot of interactions. So if you see cimetidine, I would be very cautious. So don't use that. So H2 antagonists, mechanism of action would be they bind H2 receptors on parietal cells and decrease acid production as well. Side effects will be headache, sometimes even confusion with older people. So cautious with older people, and as well as renal and hepatic dysfunction. So you need to evaluate those for renal patients. Quick summary. GERD will require PPIs, antacids, or H2 antagonists. So PPIs, that's the main treatment.